Right. Well, of course, if you don't have a vaccination, the next best way to prevent from getting the flu are the personal hygiene techniques that we talked about, both personally and company-wide, by using again, sanitizer, cough and sneeze precautions, hand sanitizer, no-touch trash cans, Kleenex. So the education is the next best thing to the vaccination. And if people do wind up getting ill with influenza, then again, the treatment for that, if they need to be treated, not everybody does, but in more severe cases, they need to be treated. It's either Relenza or Tamiflu, and sometimes some other antiviral medications. But in the absence of a vaccination, again, we offer the antiviral program, which can at least assure one that they have access to the medication should they need it. Not that they should just go ahead and take it if they feel like they have a fever. It still needs to be prescribed by their family doctor. The point of having the antiviral program in place is so that you're assured of having access to the medication should they be prescribed it when the pharmacies are out.
Okay. Let's see. Are there any legal obstacles to conducting or mandating symptom screening?
Are there legal obstacles? Oh, that's a good one. You know, I'm not a lawyer. These are strategies. The strategies that I've outlined are consistent with public health guidelines. You know, clearly, if you write a new policy and your company policy is to have your company attorney review these things, then by all means have your attorney review them. But what I can tell you is that the strategies that we outlined today are consistent with public health strategies putting out by the CDC and the World Health Organization.
Okay. Let's see. Will there be links to tutorials that an employee can use to self-educate them on this issue? And if so, do versions exist in Spanish?
They do exist in Spanish. The ones that the interactive tutorial that I showed, we can send you a link to, and yes, it is available in Spanish.
Okay. And let's see. Looks like we've got
so Ira,
one or
perhaps
two
we'll include
more.
that in the. Ira will include that in the follow-up.
In the follow-up email, that was we were already going to plan to include some of the English, but we'll make sure that if the Spanish is at a different link, we'll add that link in too.
Absolutely.
And let's see. Let's see, if we enroll employees in the antiviral program and you give them a prescription for the Tamiflu medication, how do they know when to use the prescription?
Right. Okay. Well, the program comes with what's called an antiviral medication appropriate use statement, and this outlines what the purpose of the program is, as I've explained, that the purpose of giving them the Tamiflu prescription or the actual medication is for them to hold that at home in their medicine cabinet in the event that they become ill. They're not just to take it. They become ill. They think they have the flu. They go to see their doctor. Their doctor says, yes, you have the flu. I'm prescribing Relenza or Tamiflu. And the doctor says, oh, by the way, all the pharmacies around here are out of Relenza or Tamiflu, but here's your prescription, so good luck. Well, that's the point at which this program becomes effective, because the patient will then, like I said before, can say to the doctor, no problem, doc, I have Relenza at home, or I have Tamiflu at home. My company provided it to me in case this might happen, so I can go home and take it and get better in a couple days. So it's not just to be taken if somebody feels like they have a fever or the flu. It's to be, you know, stockpiled or hoarded, if you will, in the event that they are prescribed the medication and it's just not available at the pharmacy. They have a supply.
Okay. And let's see. Looks like we've got few more minutes and only one more question, and I think you may have kind of answered this one already, but I'll ask it to you and give everyone a last chance to ask any final questions. So this last one here is, why should we pre-order Tamiflu?
Oh, yeah, well, I think that's, the concern is, just as with the flu vaccine, is there could be both flus around at the same time. We know that we have H1N1 already starting. Actually, New Jersey has been lagging most of the rest of the country in activity, where some states where people have a flu-like illness, what's called influenza-like illness, or ILI, have 50% or more of those actually diagnosed with flu. In New Jersey, so far, it's only been 14%, but it's rapidly climbing. So we're going to have a peak in H1N1 over these next few weeks, and then the seasonal flu is going to start to kick in. So you're going to have those people getting sick, and then you're going to have all those people, not all of them, but you're going to have a lot of those people who need to be medicated now have to go out and get Tamiflu or Relenza. So the concern is that there's a lot of people sick with influenza that need to be medicated, and the pharmacies in different areas just plain run out of it. And maybe they'll get some more next week, but you're sick today and you can't get it, so you have a stockpile. So that's why you'd want to pre-order it before both flus are hitting heavy. So it's really something that, if you're going to do it, we would want to get it done in these next couple of weeks. Okay, so did we cover everyone's questions? Anything else? Well, I want to thank everyone for coming, and we will send a follow-up email with the items that we spoke about, some educational materials and some links. And you have our contact information if you're interested in any of these programs. And again, thank you all for joining us today. Ira, do you have anything else?
Nope, that's all the questions, and it seems like everyone is attentive, and so I think we covered everything.
Okay. Thanks again, everyone.